Imagine walking into a hospital, but there are no doctors, no nurses, no stethoscopes, no clipboards, no human hands guiding your care. Welcome to Agent Hospital in Beijing, China, the world's first fully AI-controlled hospital. Here, in a single day, 10,000 patients are diagnosed, treated, and discharged, all without a single human doctor. You step inside. The corridors are quiet. Digital screens flash vital signs. Robotic arms glide silently, preparing medications. AI systems monitor everything, from heart rate to facial expressions, from subtle movements to the tiniest sign of discomfort. You scan your ID at the entrance, and instantly, the AI knows your complete medical history, your past illnesses, lab results, allergies, medications. It analyzes 350 gigabytes of data per patient in real time. Before you even feel pain, before your body signals distress, the AI predicts your problem. It knows when your blood pressure is rising. It detects subtle grimaces that indicate discomfort. It notices even the smallest irregularity in your breathing pattern. And it doesn't stop there. AI doctors don't sleep. They don't get tired. They don't forget. They don't make mistakes. They don't discriminate. Religion, race, or social status means nothing. Their only goal is perfection in treatment. Every AI doctor is powered by advanced large language models, trained on clinical medicine, emergency protocols, surgeries, and pharmacology. They learn, evolve, and improve every day. Imagine sitting in a room where one AI system can simultaneously monitor hundreds of patients, make accurate diagnoses, prescribe medications, and even adjust treatment plans in real time. What would take a human doctor years of training or weeks of observation, AI does in mere seconds. Visualize it. Patients moving through silent corridors, glowing displays tracking vital signs, robotic arms preparing injections, data streaming into the AI brain. The hospital is alive, but not with humans, with intelligence, pure intelligence. And the most terrifying part? This is only the beginning. Humans are slowly becoming observers. Machines are learning to run hospitals faster, smarter, and more efficiently than any human ever could. Ask yourself, when the machines can learn, adapt, and perfect healthcare faster than humans ever could, what role will we play in the hospitals of tomorrow? Will humans still be doctors, or merely patients of a system we cannot control? Across the globe, the future of healthcare is quietly unfolding. At the University of Florida Health Center, Michael Dieter waits for a lung transplant, but his ICU is unlike anything we've ever seen. This is a smart ICU, a room where technology watches, listens, and predicts every movement, every breath, every facial expression. Cameras mounted above, sensors embedded in the walls and bed, advanced monitors attached to Michael's body. They all feed data to a central AI brain. Each patient generates 350 gigabytes of data every single day. Information on vital signs, micro-expressions, sleep cycles, and activity levels. AI processes this information in real time, detecting patterns humans could never see. Before Michael even feels pain, before his body signals distress, the AI knows his problem. It knows when your blood pressure is rising. It detects subtle grimaces that indicate discomfort. It notices even the smallest irregularity in your breathing pattern. And it doesn't stop there. Are you comfortable? Are you moving enough? Is the lighting okay? Do you need help? The AI asks these questions silently, constantly, monitoring and learning. Human doctors and nurses are still present, but their role is shifting dramatically. No longer buried under mountains of paperwork, they receive clear, actionable insights from the AI. The system tells them instantly: a patient's oxygen saturation is dropping, heart rate fluctuating, or blood pressure is spiking. Every anomaly is flagged before it becomes a life-threatening issue. Here, AI replaces reaction with prediction. It anticipates complications before they occur, guiding doctors with precise recommendations and alerts. Yet, despite its immense capabilities, AI is not meant to replace humans entirely. Ethical judgment, empathy, and personal care, the human touch, remain irreplaceable. Visualize it. Michael lies in bed as sensors track his vitals. Digital overlays display heart rate, oxygen, movement, and stress indicators in real time. Doctors consult AI dashboards that provide an instant summary of his condition, trends, and predictions. At night, the ICU hums quietly, lights dimmed, while AI systems continue monitoring every patient, ensuring safety around the clock. This is the rise of smart hospitals, a seamless integration of human expertise and AI intelligence. It's not just evolution, it's a revolution in healthcare. Predictive medicine, real-time interventions, a glimpse of the hospital of tomorrow, where care is faster, smarter, and almost flawless. And as AI continues to learn and adapt, the line between human oversight and machine intelligence blurs, leaving us to wonder, how far can AI go, and what will be the role of humans in this new era of healthcare? Step inside Agent Hospital in Beijing, China. The corridors are silent, almost eerily so. There are no human doctors rushing between rooms, no nurses pacing the floors. Instead, the hospital hums with the precise, efficient rhythm of machines and artificial intelligence. Here, a patient walks in complaining of chest pain. Within seconds, an AI doctor scans their digital medical history, reviews past lab results, allergies, medications, and combines it with live vitals collected by sensors embedded throughout the hospital. In less than a human doctor could pick up a stethoscope, the AI has diagnosed the issue, prescribed medication, scheduled follow-ups, and updated the patient's recovery plan. In the surgical wing, robotic arms glide with precision unimaginable to human hands. AI surgeons perform complex operations, guided by vast data sets of thousands of prior surgeries. They adapt in real time, learning from each procedure to improve outcomes. One AI surgeon completes in an hour what might take a human team 3. Every cut, every stitch, every dose of anesthesia is perfectly calculated, leaving almost no room for error. The AI system is supported by virtual nurses. These AI nurses measure vitals, administer medications, track recovery, and even remind patients to eat, hydrate, or take preventative actions. Every patient is constantly monitored. Every change in behavior, every micro-expression, and every subtle shift in vitals is recorded and analyzed instantly. Patients are astonished at the efficiency. No waiting, no errors. Care is precise and consistent. Because AI doctors don't sleep, never forget, never get fatigued, and never show bias, every patient receives the same level of attention regardless of background or status. Imagine this. In a single day, 10,000 patients are diagnosed, treated, and discharged. The hospital operates like a perfectly synchronized orchestra, with intelligence and technology replacing every human limitation. Every interaction teaches the AI something new, constantly evolving to become smarter and more accurate. Yet the human element is missing. AI can predict complications, administer treatment, and perform surgery, but it cannot comfort a frightened parent, hold a trembling hand, or offer emotional reassurance. Patients feel amazed, but also strangely isolated. The hospital is flawless, but not human. Visualize it. Robotic arms performing surgery with cinematic precision. AI dashboards analyzing patient data in real time.
corridors of patients moving smoothly through automated systems, and streams of data flowing to central servers that learn from each encounter. In Agent Hospital, all human errors are eliminated, all limitations overcome. Care is faster, more efficient, and unprecedentedly accurate. But one question lingers. If machines can do it all, what will become of human doctors? Will they remain guides, or will they be observers in a world run by AI? The revolution of AI hospitals is not just about replacing doctors. It's about transforming the very concept of healthcare. In a world where machines can work tirelessly, errors that once cost lives are now eliminated. Every prescription, every diagnosis, every surgical move is calculated with precision. Zero errors every time.
Imagine a hospital where patients no longer wait for hours or days for treatment. In Agent Hospital, the AI sees 10,000 patients in a single day, diagnosing and treating them in minutes. For complex surgeries, AI surgeons can analyze thousands of previous cases in seconds, ensuring the safest and most effective approach possible. This is healthcare at the speed of thought, something human doctors could never match. Cost reduction is another staggering benefit. Hospitals spend billions annually on salaries, overtime, and human resources. AI systems require no breaks, no salaries, no pensions. They reduce waste, optimize resources, and ensure medicines are administered only when necessary. This means affordable treatment for millions, making healthcare accessible to populations that previously could never afford it. AI hospitals also enable personalized medicine at a scale never seen before. Each patient's medical history, genetics, and real-time vitals are analyzed instantly, allowing tailored treatments that maximize effectiveness and minimize side effects. Traditional healthcare struggles to achieve this level of precision due to human limitations, but AI accomplishes it seamlessly. Globally, the implications are profound. Countries with overburdened healthcare systems like India or parts of Africa could deploy AI hospitals to fill critical gaps, reaching rural areas where doctors are scarce. Lives could be saved by preventing misdiagnoses, speeding up emergency care, and ensuring every patient receives consistent, high-quality attention. The benefits are undeniable: faster care, higher accuracy, cost efficiency, and equitable access to medical treatment. AI hospitals can work 24/7, 365 days a year, never fatigued, never biased, constantly learning and improving. Yet, there is a deeper question. With perfect care provided by machines, what becomes of the human touch in medicine? The empathy, reassurance, and moral judgment humans bring. Can machines ever truly replicate that? The rise of AI-controlled hospitals promises incredible efficiency, but it also raises critical challenges and ethical questions. As machines take on roles once reserved for humans, we must ask, how far should AI be allowed to control healthcare? In Agent Hospital and smart ICUs worldwide, AI can monitor thousands of patients simultaneously, detect health complications before they occur, and perform surgeries with perfect precision. But these advancements come with risks. What happens if a system error occurs, or if an AI misinterprets data? Who's accountable? The programmers, the hospital, or the machine itself? Another pressing concern is trust. Can patients truly rely on AI to make life or death decisions? In traditional hospitals, human doctors can comfort a scared patient, explain procedures, and offer reassurance. AI lacks empathy and cannot hold a hand, calm nerves, or provide moral support. For many, this human touch is as vital as the treatment itself. Privacy and security are also major issues. Smart hospitals collect gigabytes of sensitive medical data daily. Patient histories, vital signs, genetic information, all stored digitally. A single hack could compromise thousands of lives. How do we ensure AI remains secure, ethical, and unbiased? The global implications are immense. Nations that adopt AI hospitals first may gain a significant healthcare advantage, providing faster, cheaper, and more accurate treatment. Others may lag behind, widening the gap in global health equity. Countries with limited resources might struggle to implement or maintain such advanced systems, leaving vulnerable populations at risk. AI also challenges the role of human doctors and nurses. If machines can diagnose, prescribe, and operate, what will be left for humans? Training, supervision, and ethics might remain, but the emotional, intuitive, and moral aspects of medicine are harder to replace. Ultimately, the question is not whether AI can do it all. It can, but whether society is ready for a world where machines make decisions that impact human lives. Regulation, oversight, and ethical frameworks will be critical to ensure AI enhances rather than replaces the humanity of healthcare. As we step back from the corridors of AI hospitals and smart ICUs, one thing becomes clear. The future of medicine is transforming before our eyes. From Agent Hospital in China to smart intensive care units in Florida, artificial intelligence is reshaping how we diagnose, treat, and care for patients. AI systems can now monitor thousands of patients simultaneously, detect health complications before they occur, perform surgeries with precision, and provide personalized care at scale. What once took hours, days, or years can now be achieved in minutes. The possibilities are staggering. But the future is not without challenges. Human empathy, moral judgment, and emotional connection remain irreplaceable. AI can save lives, increase efficiency, and reduce costs, but it cannot comfort a frightened parent, offer hope to a patient, or understand the complex nuances of human emotion. The ultimate vision of healthcare must combine AI precision with human compassion, ensuring that technology augments rather than replaces humanity. Globally, the integration of AI in hospitals could redefine healthcare access. Overburdened systems in countries like India or Africa could finally provide timely, high-quality care to millions who previously had none. Rural communities once underserved could receive the same standard of treatment as major urban centers. This is a world where life-saving interventions are no longer limited by geography or resource availability. Yet, ethical considerations, privacy concerns, and the potential for dependency on machines cannot be ignored. Society must implement regulations, oversight, and robust ethical frameworks to govern AI healthcare, ensuring it is safe, unbiased, and equitable. Decisions that affect human lives require accountability, transparency, and careful supervision. The vision of the future is both inspiring and cautionary. Hospitals run by AI may operate flawlessly, 24/7, with zero errors and unmatched efficiency. Lives will be saved, costs reduced, and healthcare accessibility revolutionized. But humans will remain the heart of medicine, the conscience, the comfort, the moral guide. As we move forward, the question is not whether AI will change healthcare. It already is. The real question is, are we ready to embrace it responsibly, ethically, and with humanity at the center? As AI hospitals continue to evolve, the global impact of this technology becomes impossible to ignore. What started as a revolutionary experiment in Beijing has the potential to reshape healthcare worldwide. Nations that adopt AI systems rapidly will gain a profound advantage, reducing medical errors, increasing efficiency, and saving millions of lives. Imagine rural villages in India, Africa, or Latin America where medical resources are scarce. AI hospitals could bridge this gap, bringing world-class healthcare to places that once had none. Patients who would have traveled hundreds of kilometers for treatment can now receive care locally, guided by intelligent machines that operate 24/7, analyzing data, predicting complications, and providing precise interventions. The AI also transforms medical education. Human doctors are no longer the sole source of expertise. AI systems can train students, simulate complex surgeries, and evaluate performance, ensuring a new generation of healthcare professionals learns faster and more effectively. This accelerates the spread of knowledge and raises global medical standards. However, this global revolution is not without challenges. Countries that lag in AI adoption risk widening healthcare disparities. Without careful planning, unequal access to AI technology could create a two-tiered system where some populations enjoy near-perfect healthcare while others remain underserved. Ethical frameworks, data privacy, and equitable deployment must guide the worldwide rollout of AI hospitals. AI also invites geopolitical implications. Nations may compete to develop the most advanced AI healthcare, not just for healthcare, but as a strategic advantage. Control over AI healthcare technology could become as critical as energy, defense, or information dominance. Collaboration, international standards, and regulation will be essential to prevent misuse or exploitation of such powerful systems. Looking ahead, the next era of medicine will be defined by partnerships between humans and AI. Machines will manage diagnostics, predict diseases before symptoms appear, and perform life-saving interventions. Humans will focus on compassion, ethics, and personal care, the qualities no AI can replicate. Together, they will create a healthcare system that is smarter, faster, and more humane than anything the world has seen. We stand at the dawn of a new medical era, one where machines and humans work side by side, where technology empowers caregivers and patients receive care that is both precise and profoundly human. The question is no longer whether AI will change healthcare. It already has. The question now is, are we ready to embrace it responsibly, ethically, and with humanity at the center? If you enjoyed this video, like, share, and subscribe to the channel for more what-if scenarios. Don't forget to hit the bell icon to stay updated.